C was 6.8 and now it's 4.6, right? Their cholesterol, they lowered it by 16 points just in 1 month. We've had IBS patients of 22 years be like, this is the best I've felt in 22 years, right, of dealing with IBS. So it's totally possible when you're able to start with yourself and truly help yourself feel and be well and healthy, it ripples into your family, into your spouse or your significant other, your children, your extended family. You become this light, this beacon to the world. And then connecting it back to today's topic with inflation and finances and taxes, you are decreasing that money going to these things. You're like, I don't need the Medi-Cal. I don't need the Medicare. I'm good. I'm healthy. I'm feeling great. I'm going to go to a insurance share system that's outside of the system. I'm going to give my money to a healthier company that is an insurance share system where we all kind of share. And that can be in the next episode where we get into the nitty gritty of that, of how to save money with your insurance. And it's still going to cover if I do break a leg or get into a car accident. I'm not saying to anyone, disclaimer, cancel your health insurance or anything like that. But there's much better ways to do it, especially if you're feeling good, if you're healthy, and to just be smart with your money, guys. Make that dollar stretch. And really, all of these things check so many boxes. We eat lots of plants, and thankfully, plants for us, I mean, and for many of you, are very expensive, guys. I don't know if you've seen a big bag of whole grains, whether it's brown rice or wild rice or quinoa at the grocery store, is much cheaper than even like one Chick-fil-A visit. A big bag of dried lentils or beans or peas is much cheaper than that Taco Bell drive-through, right? You can feed your family for the entire month, if not months, on that versus one trip to fast food. So it's just rethinking, guys. It's understanding these things aren't serving me immediately and even long term. These same companies who are promising me a cheap meal are lobbying our government, and they're receiving my tax dollars in order to give me that cheap meal. Enough is enough, right? We have to opt out of this. So if you enjoyed this topic, let us know down below. We're excited to bring you more topics like this. I was inspired, like I was showing you and explaining, just, hearing other health professionals kind of give some misguided information really upsets me. And so I have to just correct it. I did correct it. I raised my hand and asked questions and just kind of pointed some things out there. But I also want to do it in a larger scale as well. This will live on, and we can save it, we can clip it, and it'll live on. So we need to do that as health professionals, holding each other accountable. As health professionals, we hold our patients accountable. As health professionals, we look toward a regenerative nutrition, a regenerative healthcare future where when you're in our care or in true healthcare, you become healthy. Right now, when you're in the average healthcare, you're staying sick. How does that make sense, right? So we need to change that.